Hello guys, welcome back to my channel, and today we're going to learn about the anatomical landmarks of maxilla. So let's begin. So this is a cast, alright, and this is the maxilla. As you can see, it is actually supposed to be like this on the upper side, like this, and there will be a mandible which we will be covering in the next video. So first let's learn about the important landmarks of maxilla. I have painted and I've made border also for these. So basically the anatomical landmarks are divided into three parts based on the functions, or the places and the function of each area. So the three areas are: first one is the stress bearing area, second one is the relief area, and third one is the limiting area. The stress bearing area, that is the stress created by the mastication of food, alright, that is created. So there are two types, one is primary and one is secondary. The primary one is residual alveolar ridge and posterior lateral slope of hard palate. So what are the two stress bearing areas? One is this yellow portion, you can see this is called the residual alveolar ridge, and this dark green portion, these are the posterior lateral. Posterior is behind and lateral sideways. Posterior lateral slopes of the hard palate. This is the hard palate. Alright. Now the secondary stress bearing areas, one is the rugae. This orange portion, this is called the rugae. It is a soft tissue. And maxillary tuberosities, these red circles, these are the secondary stress bearing areas. And so basically they help in whenever we prepare the dentures. So the stress that the tissues that bear the stress are these of the denture. So now the relief areas. Relief areas are nothing but the areas on the plaster model that relieve pressure on the tissues underneath the denture base. Basically, what are these? These are the areas where the pressure that is created by the dentures are relieved. So basically they help. Okay, so what are these relief areas? One is the incisive papilla, then median palatine raphe, and cuspid ridge. So let's see where are these on the cast. The incisive papilla is this circle over here on the top. This is the incisive papilla, and when you continue over here down till here, this is nothing but the median palatine raphe. Alright, and here these are the cuspid eminence, okay, over here. So these were some relief areas. Now the last one, that is the limiting area. So the limiting areas basically form the boundaries. Okay, these boundaries, these will be the limiting area for the denture, and we shouldn't cross these. So what are the limiting areas? One is the labial frenum, then these are the buccal frenum, the red ones. Okay, frenum is the it is a tissue over here, basically like a frenum. It is kind of elevated, and when you take the impression of a frenum, then it creates a notch, that is a depression. Okay, so this is a cast. So impression is nothing but the negative impression of a cast. So if there is an elevation, there will be a depression on the impression, and if there is a depression over here, there will be elevation on the impression. Basic logic. And labial vestibule is this small shallow sulcus over here, or labial vestibule is also called as labial sulcus. and buccal vestibule or buccal sulcus. And this fluorescent pink color which you can see, these are the hamular notches, and this brown one is called the vibrating line. And two dots over here, I think you can't see over here clearly, but there are two dots over here sideways. So these dots are called as fovea palatine. And so these were some important anatomical landmarks. Let's see the clinical significance of each landmark. So as I had told before, when you take the impression, there is a notch created. So the labial frenum will create a labial notch for the impression, and the labial vestibule will create a labial flange in the impression. Okay, the flange is a elevated kind of, and buccal frenum will create a buccal notch, and buccal vestibule will create a buccal flange, and the residual alveolar ridge, yellow one, will create a alveolar groove, and the maxillary tuberosities will create a maxillary tubercle fossa. Okay, and what else, this incisive papilla will create an incisive fossa. So let's just and this hamular notch will create a pterygomaxillary seal over here. Okay, the hamular notch. So the hamular notch, which is the pterygomandibular raphe, attaches to it. The pterygomandibular raphe attaches to it, and the denture shouldn't extend beyond this hamular notch. If so, it will result in a restricted pterygomandibular raphe movement. Okay, so this was the clinical significance of this, and few more, like we'll just see, like the maxillary tuberosity. Okay, so it shouldn't be placed, the last tooth shouldn't be of the denture shouldn't be placed on this maxillary tuberosity. Okay, and it is also used for the retention of the dentures. And let's just see few nerves and vessels and the muscle attachment on these. Like the labial frenum of the maxilla, this one over here, this is passive, while in the mandible it is active. Why is it passive? Because there is no muscle attachment on it. And the incisive papilla, there is a maxopalatine nerve and vessels that pass through the incisive papilla. And the fovea palatine, those two dots which I had told, over there is the opening of mucous and salivary gland. Okay, so this was something, few information about the maxilla, and in the next video we will be covering the mandible. Hope you liked it, guys. Thank you.